Where do you see fertility treatments going in the future?
Because women are delaying childbirth.
Still have more questions. Kab hone wala hai? When are you going to just stop asking?
So, it's value that you want.
Hi, Mommy.
When you saw the positive result,
I think I fell down to my knees.
should I give up my job?
Just stress mat lo.
How do men handle fertility issues which come up in men?
It is the both of you versus the problem. The one role I needed to fulfill in this life was of a mother.
Welcome to Unspoken. I'm Dr. Mamta Dighe, a gynecologist and fertility specialist. My mission here is simple: to create conversations that not just inform, they heal, guide, and empower. We've called today's episode Trying, Waiting, and Hoping. If you've ever longed for a child, struggled with fertility issues, you know just how much these three words mean. We're not just talking about science here, we are talking emotions, the kind of truths rarely spoken out. And today for this episode, I have none other than Kaehalee. She is a psychologist herself, but more importantly, she's a proud mother of two very beautiful IVF children. She knows the science behind it, but she also knows the silence, the struggle, the heartbreak, and the miracles happening. So happy to have you here, Kaehalee.
Thank you so
It's a
much.
pleasure having you.
Thank you. Thank you so much for having me. It is the fact that I get to sit here and when I look back at starting of that journey, I think that woman would be so happy.
Very true. And I think, that's exactly, I'm so happy having you here. You're just such a, allow me to say so, a perfect combination of what people need to hear, because you can bring both perspectives, what happens inside and how to cope with it.
Yeah.
But from a very, very, very personal standpoint also. So, you're not coaching somebody.
Yes.
You're sharing something. So I think that makes it all the more beautiful, wonderful, and accepting for. So let's start at the very beginning. The science and medicine comes later, but first is that, when you realize that, you were finding it difficult with fertility and may need to seek help for fertility issues. And how did you navigate through all the emotions and feelings that kept coming up?
So see, I come from a family of doctors, right? So it's a very scientifically oriented, very logical and practical thinking household. But I think the day you know that you're going to get your period is the worst. It's the worst. And it goes as a cycle, I think, every month where you kind of crash, and then the hope rises again, and then you're trying again and it's a cycle of disappointment which keeps happening. And I think eventually you reach a point where it drives you to say that I think maybe I need to take help. I need somebody to guide me better and tell me what can be done. But I think coming to that decision for a lot of people, not only from my experience, but when I see a lot of women who come to me, there's a huge element of shame. Right? Because it's inherently seen as something where you failed, right? Not your body failed or not the environment. We're not talking about, what our lifestyles are or what's been happening around us. So even when you initially know that maybe you do need help, that takes a time to process all these emotions and then finally go and sit in front of a doctor and say, well, I'm listening.
Right. I think, you just hit the bullseye when you talked about shame and guilt, probably, because traditionally as women, I sometimes wonder that it is the gynecologists who became fertility specialists. Why did it happen? Because probably the whole burden of being infertile fell on the woman, right? And that is why gynecologists are the one who took up infertility or reproductive medicine. As women, we probably can do that one thing that no man ever can, and that is bear children. And if we fail at that one, primal thing, which feels so natural,
Correct.
it's just a subconscious feeling of shame and guilt that just comes up. We don't even realize it's embedded somewhere in our bones.
Absolutely. And I think because the agency of it is so much in the woman's hand, it's the woman's body and what she eats. But also, I'm pretty sure as a gynecologist, you can tell us that there are so many factors outside of a woman's control which can also maybe affect this, right? And nobody's really talking about that.
Absolutely. So very true. It is a problem. It is not a guilt, or it is not an issue, or you are not the issue. It's a medical problem, and let's deal with it that way.
Absolutely. In terms of stigma, right? So even going to a psychologist, right, or a therapist, it carries some stigma in mental health as of today. And similarly, maybe going to a fertility specialist also carries that stigma. And a big part of this, the reason that science is developing and it is growing and coming up with wonderful advancements is so that it can help us in this journey.
Yeah, very true. Yeah. So it's like, this is one area where, like you said, you need, you have to put the aspect of shame and guilt from both sides.
Absolutely.
Physically, mentally as well, because you understand that you need coping mechanisms and help which an expert can provide.
Absolutely.
So now just taking this further, there must have been one point where you realized that you probably need help with fertility. And there must have been one point where you realize that you probably need IVF, or that you want to do IVF.
Correct.
So what had you imagined IVF to be like? How was it really like for you? How did you go through the whole process, the injections? What was the most, let's say, challenging or difficult part of the process for you? And how did you incorporate your own training to kind of, help your own self?
Yeah. So I think it was a very logical decision for me in terms of taking help and having my mom guide me throughout this entire process. I think she very clearly had told me certain guidelines that came in, that normally you should be trying for so many months, and after that, this is the next step. The tests that were done. So I was able to, the first thing I did was I sat and I understood what it meant. And that's what I always believed through the journey as well. It's the one thing I kept telling myself, I'm meant to be a mother. I know that in my heart, and I'm going to reach there some way or the other. And for that, I need to accept what road is not for me. So when I trusted science, and when they said that, look, 3 IUIs, give it a shot, and that didn't work, the very logical next step was IVF. Also, considering that I'm also a career woman and I have a certain timeline in mind, I had also considered what my mom told me about egg quality, and it's better that if you start the process, start it sooner, so that the end goal is a healthy baby. When I initially was looking also for a fertility specialist, I was looking for somebody who would talk to me. And I think the most important is when they sat and they just explained every part of the process to me, because a big part of this was me having an intention that I want to do this. I knew that this was my step, but what really helped me kind of settle was when they explained everything to me, so I knew what to expect. I still have a diary, which there's a checklist of, okay, this is done, and then this is done, and then this is done. But I think really what helped me was I didn't make it my entire life. It was a part of my life that was happening. I was still working out. I was still meeting my friends. I was still going to work. And I think that's what I told myself when I was starting the process. It is impossible for a woman not to put all her hopes in that basket and just keep looking forward to that, yes, this is gonna. But what really kind of helped me slow down was that I didn't make it my entire life. And that was not the only thing that I was doing. So life was happening, this was happening parallelly to it, and it took the full focus and stress off of it. But it was still a very anxiety-provoking process. I think you're coming in and how many follicles and how many are of a okay size, and
True.
It starts initially from also, is the lining okay, right? And every part and every visit would come with an anxiety of, is this okay? and is this okay in this cycle, and kind of just because it's a long process,
Right.
no, it's not just you went in, that one procedure is done and you came out. I think there are so many steps and milestones within that process itself, that you clear one and you're like, okay, one is done, and then on to the next. I've always been okay with taking injections, so I was a
That
little,
wasn't so tough.
I was a little tough about
Right.
it. Like I went through it, I think, but all these anxieties and meeting every milestone and then watching out for what's next and what it should be like. And I think the hardest part I feel for women is that you're doing it all alone.
Mhm.
You're doing it in isolation. You're not really talking to anybody about it. You're reading up all this information online just by yourself, to know, and with nobody to talk it with and help it through. So having that would have, I think, really
Made a
been,
lot of difference.
Yeah.
I think, you have brought out such relevant points here, both medically and emotion related. One is you realize the importance of doing it early.
Yeah.
The problem is that people think that, oh, it's IVF, you just make an embryo and put it in. Why would it not stick? You've done everything, right? And now my job is just to let it stick. But it's not that. It's how good that embryo is. And that does depend majorly on the egg quality and how young the woman is. So making the right decision at the right time is so important. You were lucky, probably you had a mother who could guide you that the quality also matters and it is going to deteriorate with age. So this is a very important take-home message for anybody who's listening to this, that age matters. IVF is not a panacea for, okay, now I'm 40 and I don't have children, or 45 and it can still work. It can, but who knows how many attempts it will take and who knows what the success rate is going to be.
Absolutely.
The second thing that you mentioned, I think, is not making it, it is just a piece of the pie. That's exactly what I tell people. Women, the first thing say, should I give up my job?
Yeah.
Should I just sit at home? I say, please don't do that, right? Please don't do that, because it's not just a part of your life. Your entire being does not depend on just being a mother. There are so many aspects, and it'll help you cope with it better, whatever the outcome. That is also very, very important.
Absolutely.
And I think having people around you who will be there beside you through the ups and downs, because however much your spouse is there in it, physically you're the person who has to take
Absolutely.
the
And
brunt
I think
of
it's
it.
very important to have a community of women who understand this language, who understand what it is. The anxiety is going to follow. I mean, anything that you care about is going to make you slightly anxious because you care about the outcome.
Yeah.
So,
And because it's not a guaranteed outcome, right? I mean,
Correct.
that is what, if somebody was told, go through this, it's 100% outcome, you're okay, you'll go through whatever it is. So yeah, that matters. And, we've tried to do that at Zenith, like have a hope circle, guide people and tell them that, this is not the entire life, but at the same time, have a community where people can share and, people can discuss this and have that support, like we have your back kind of a thing.
Absolutely. These support groups are really wonderful. And I think it's the most important part of an IVF center, because it does take the stress off.
Yes.
As human beings, we want to connect, we want to share, we want to feel seen.
Yeah.
And I think people coming in giving advices like, just stress mat lo. I mean, it's not really helpful advice.
Yeah.
But yeah.
Yeah, no advice, please, if this is the advice.
Correct.
No, I understand. So very important to, look into all the aspects. Tell me one more thing. How was it with your spouse, with your husband? Because, at many times women feel lonely and they don't feel seen, right? It is one thing to say that I understand, but it's one thing to also communicate that I know you're bearing the brunt of it. I'm equally in it with you.
Yeah.
And also I want to ask, as a subsequent question, how do men handle fertility issues which come up in men? Because it's looked at as a woman's problem, but it's not. 50% of the times it is the man. We're not trying to shift blame here or, fix blame
And
here.
there is no blame, right?
Yeah.
Like, I mean, there is no blame. There are two people who are kind of coming together. But
Exactly.
yeah. I have just one question in the middle of this. Do you feel that when it is a male factor issue, do you feel that it has better outcomes in terms of IVF? Like in terms of, is it easier than when there are women like oriented issues?
Yes and no. Yes, because the bottleneck is the number of eggs that a woman gives, right? Even if the male has 1 million sperms, or even if we can take 10 sperms from the testis in a patient of, azoospermia, if the woman gives me just 2 eggs, even those 10 sperms can't do anything.
And the reason I asked you this question is, frankly, be slightly happier if it is, right? Like in terms of that. So I think just change the perspective with which you're looking at it, because if you accept what it is, the outcome is going to be easier as you follow through with it, right?
One thing, let me interrupt. We've had cases where, the man has been diagnosed with a male factor in denial. They have tried doing everything possible under the sun except for embracing, the correct treatment. And by the time they come back to us, the woman's egg reserve has gone down. And now I can get sperms from you, which will not lead to a natural pregnancy, but good enough for an IVF conception. But I don't have enough eggs in the woman. So, it's very sad. So it's important for men to understand.
Absolutely. But I think that there are so many identity issues and this toxic sense of masculinity which can get attached to these external parameters that men are sort of judged upon. They don't get space to express their feelings, and it could be that they're feeling anxiety, but it does get presented as anger, right? The frustration, the irritability, and many a times it becomes just a denial to engage with the process.
Right. So addressing these core issues for them also becomes important. And, you drove the way you said it, that be happier about it. Yes, why not? I mean, there are good enough eggs. So even with a little bit of less sperms, the outcome is going to be much better. So I think that's a very important point.
I think it's just a shift in perspective. That's all I wanted to bring. That sometimes acceptance and embracing of where you are, the more you struggle against it, the harder it's going to get, right? So I think acceptance and embracing is very important.
It is a shared journey. I think the problem also is because they're confused about what to share and how much to share. So it does become difficult. But like you said, things are changing. I started IVF more than 25 years back. And I remember women would come in with a lot of anxiety and fear, guilt, that they are the problem. And in case they don't conceive, their marriage is at stake, And now I see couples coming in and the husband holding her hand and looking me in the eye and saying, "Doc, I don't care whether, the child comes or no. My wife has to be taken care of." And it's very, very heartening.
It is. I have some clients who are also going through the process, and I see their husbands kind of show up to them and saying, "Hey, this is your body. You decide how you want to go through it. I'm right here through the process as to what needs to happen." And I think the one thing I encourage them to do is communicate to each other, just empathize, because there's no way to know exactly what's going on in each other's minds. But being able to share that and give that insight into each other's world also helps a lot.
And I think even families, being scared of what in-laws will say. And I had one mom-in-law come with her daughter-in-law, and she said, "Doc, it's for my son, there's hardly anything to do. But my daughter-in-law is going through a lot." So she's the one who, I want to make sure is cared for. And it's a lovely thing that's happening. And maybe, if we see more and more of it, that'll be so wonderful. But that brings me to one more question. How can then these two partners, I mean, how would you counsel, a couple who comes to you with this issue where, there's no balancing. One is feeling a lot more, the other is probably in denial, and then there is a lack of support or understanding. How do you approach such situations?
So denial is also a form of maladaptive coping, right? There could be a partner who shows up more anxious and there's a partner who shows up in denial, but that can also still be a part of emotional processing. Guide both of them in their own individual processes to allow them to, and it's going to take time. I think a lot of times what happens is, you consult somebody and maybe it's like, oh, what decision should we make? It can't be like that. You're going to have to take time to kind of understand, come on. And that's what happened with us. I was 10 steps ahead, but like you said, it's a communion. I can't be running ahead and tugging him behind me. He has to come on one page with me. And sometimes it's okay to slow down in your process. Right. I am the person who shows up very anxiously, let's say, in the dynamic, and that can be overwhelming for the partner to kind of just play catch up, It's important for me to slow down. It's important for the partner to take a step up, right? And that's going to allow them to come on one page. So, and it's not going to be a one-time thing that you do. It's probably going to happen throughout the journey, yes, at different phases. And it's not only during the trying to conceive journey, it's going to happen later on also in life, as parents and things like that.
Absolutely, yeah.
So the whole goal is to kind of keep tuning into each other and keep checking in with each other. So empathizing with each other's process is very important. As human beings, we tend to we look at the situation through only our perspective.
Yes.
A big part of emotional intelligence is to be able to put that aside and for a moment consider, okay, maybe this is where my partner is at as well, but be very intentful to meeting each other.
Very true. I think, like we've been speaking about women going through so much and, men supporting them, but sometimes men are not speaking out and are going through equally as much.
Absolutely.
Without that consideration being handed over to them. And that is why as a spouse or as a wife and, as a family, when you say you have to read between the lines, it is so important to be connected that you understand what they're not saying.
Absolutely. And I think if you think about the patriarchal society, I too feel it does way more disservice to men than it does to women, because you're not giving them space to have feelings, which eventually trickles down to women and then they're bearing the brunt of them. But it operates through them where they're not being given permission to feel sad or anxious or or they don't know that even if I feel these things about this journey, about what's going on, because there are men who are showing up with this want to have a baby too. They also want to have a baby, and they just don't have a space to maybe even safely express it.
Yeah, very true. The issue is that it's so easy to label something. You carry both masculinity and femininity, right? I mean, both women and men have aspects of both. And we need to kind of hold space to be able to express both. I mean, you can't, I think that unless... you can't hold softness unless you have made peace with your own tenderness. It is so important, even in a relationship, for that to happen. So I think very important. And I think one point that you made right in the beginning, and probably even now, some aspect of it has come in, is like, the clinic or the doctor being able to guide you through with a lot of patience, explaining a lot of things and making you comfortable, right? Because sometimes when you're rushed into things, when you're made to think that, oh, if you don't do it now, then there is no way out. If you're not given the complete explanation, if there's no transparency, then it becomes an additional burden to bear. So that aspect of, the person or the clinic or the doctor treating you also plays such an important role.
It absolutely does. So I think what happens is sometimes we go through this process with so much fear. Like if you even think about, so both my children are absolute natural births, right? Unmedicated, natural deliveries. And at that point of time, I know that there was a conversation because for a lot of deliveries, they do elective C-sections because precious babies,
Yes,
right? Like you
right.
don't want to take any risks.
Right.
And I think the one thing I kept telling myself throughout it is my body is meant to carry this baby and it knows what it needs to do and it knows what needs to happen. And if that decision comes, I will surrender to it, but I don't have to make it right now.
Yeah.
And I keep saying it again that all thanks to my mom, but she told me very nicely that, look, it's here. Your baby is here. You're carrying him well. You don't need to give in to any other fears, right? This is what the body is meant to do. Your doctors are here to worry about everything else and just go through the process. So I think it's so important to keep in touch with something that grounds you.
Yeah.
And make sure that fear doesn't keep reaching.
Very true. Yeah. So, we keep talking about numbers, statistics, and success rates, but we have to understand that, you're not just that, right? I mean, you are somebody beyond that. So, having that faith that if it's going to be, it is me, is so important to hold on to. But sometimes even as doctors, it becomes difficult for us, because you have to tell them the way it is, still make sure that they don't lose hope.
Correct.
And still know that, you're doing the right stuff. You're being ethical over here. And I'm going to deviate a little over here, Kaehalee, but I want to ask you, they say that the burnout and the stress in IVF doctors is humongous.
Yeah.
Even for embryologists,
Yes.
the ones who work in the laboratories,
Correct.
because there's so much pinned on everybody looking at that success, and finally you can do only so much. The body and nature is going to do the rest, but it's so difficult to convey this. So continuously dealing with people who've not succeeded takes a toll not only on patients, but on the doctors as well. So I think,
Absolutely.
You should start something
for all my doctor friends. But I completely get what you're coming from. When people are posting on Instagram, they're talking about success stories, and nobody's talking about the stories where it didn't work through. It is a big part of the process. It has to be embraced as a part of the process. And it can create that burden, because it suddenly becomes that your shoulders are carrying so many hopes, right? And it's very hard.
It is hard because, sometimes I feel for that couple, they deal with it, but we have to see the next couple as well.
Yeah.
And whether you like it or no, you're still a participant in that journey. And it does become difficult, because inadvertently, even though you know it, you're still carrying the responsibility of making sure that they conceive, knowing that it's not completely in your hands. So,
And on the other side, I don't think as a patient, I could sit with you for another hour and my fears are still not going to go away. I will still have more questions, and they're coming from a place. So I think it's very important to kind of incorporate counseling and therapy as a part of the process, because there's this entire emotional aspect of it, which needs to kind of be addressed. So I think it really helps, because then the doctor can show up and do the doctor's job.
Yeah, absolutely, and I have seen like some of our international colleagues, they're so cut and dry about it, like sometimes when we're discussing, we'll ask like, what about this level? If this level is not exactly like this, just do the next cycle. I'm like, oh God, how can you just do that? So I think even we are so involved in it, and you want to make sure, because it is difficult at times. Even though the IVF journey, I personally feel, is not that intense in terms of physicality, in the sense you do go through it for a long time, but sometimes where it is easier than a major surgery, I mean the physical part of it, but the emotional roller coaster. And that is why it's so important, like you said, to have everything embedded into the whole practice that becomes important.
Absolutely.
Do you think that this affects their sense of identity, self-worth, how they look at themselves as a woman or a man? Have you seen a lot of people having issues like this?
I think it absolutely does. The fact that our identities are very performance oriented, definitely in India, I can say, right? Your sense of worth somehow gets attached to these external parameters where you're delivering upon, right? In our society, it will even, very rudimentary concepts like, have you delivered a male child, or things like that will come into play. So a lot of your identity is attached to these external concepts of how you're kind of showing up, what are you achieving, what are you delivering upon. And as you go through this process, and I've seen doctors and these wonderful, intelligent women who understand it, still going through the process, can find it very hard, and it shakes up your identity as a person. Especially if you give up everything just to kind of follow this, because that's the advice given, right? Don't take stress.
Give up your job is sometimes the first thing the family will tell you.
Supposedly the stress is coming from your job. I'm like, it also gives me, a lot of financial autonomy and independence. I get to go out, I get to perform,
meet friends,
be an individual, right? But it's just seen as a source of stress. And I think the one thing I had believed back then is, people are laboring in the fields and carrying babies. My life is very, very comfortable, and me going to work is really, our bodies are that resilient.
Absolutely.
And I don't really need to give up my life in order to do this. Right?
If this episode touched you, then please share it with someone who needs to hear it. And don't forget to follow Unspoken with Dr. Mamta, where we bring you stories and science that matters.